aims and outcomes is who you should start looking at for roles and functions. From there, go to your organisational structures. So there are different levels of organisational structures. You can have steering committees and advisory groups, and you can have steering committees and advisory groups at each different level of your CRE. For example, you might have them at an executive level. You might also have them at a project level, depending on what your research is aimed to achieve. Bob, are you going to talk to us about some knowledge translation and exchange?
So you'll do the button? Thanks. Yeah. I'll do it for you later. Yeah. Okay. So can I just can't see that. That's all right. No, I get it up. It'll fade. Yeah. All right. Knowledge and exchange. What is it? Look. There's a vast array of literature about knowledge and exchange, most of which I think is theoretically helpful but practically hasn't achieved a lot. The APHCRI model builds on an actual model from Canada, and that's been the basis of it. However, like all things, it can be improved, and with the APHCRI experience, we've tried to adapt that model to the Australian situation, and also to build on that model. And the parts of the model we have adapted and have kept are the presentation of research findings, both in that 1:3:25 format, and that's described on our website in some detail. And I think many of you who've been involved with APHCRI will be intimately aware with that. And that's been proven to be a useful way of communicating. We've also, as part of that, included very much a lively program of interaction between the APHCRI funded researchers and the Department of Health and Ageing. And that has taken the form both of having, for some projects we've funded over the years, having departmental people on advisory or steering committees, and that process will continue with the CREs, and also with presenting the findings orally to the department here in Canberra through a number of mechanisms, either special presentations or part of a series we have with the department called Conversations with APHCRI, where all the interested policy people from across the department can hear a presentation of the research and follow it through. Then once they get to meet those researchers, often there's been a lot of follow-up, and I think that's one of the more successful features of this, that it does lead then to building an ongoing relationship between researchers and departmental people. So that's another mechanism. We've now taken this a step further, and Vicky mentioned Peter McInnes, who's joined us a couple of weeks ago. Peter's on a one-year secondment from the department to work with us in APHCRI, and Peter was selected from a very competitive process within the department, so there's clearly interest in the department in extending the policy network into the research network. And I think this is an important development, because it's one thing to focus on the research end of it and say, well, you research guys have to get your act together and present your material that's relevant to the department and so on and so forth. But of course there's also at the department end, there's a need for the policy people who are busily doing policy, whatever that entails. But a lot of that entails very rapid work and what if type, what if we did this, quickly finding out what might be the consequence of doing X or Y. And most of it done in a sort of a very tight budgetary environment where it's not, you can't just put an ad in the paper and you can't talk to anyone outside the department, need to know and all that sort of thing. So it's getting the departmental people, I think, a better handle on, well, how does the research field actually work? What can you expect from the research field? It's not just a case of give them a question and they'll give you an answer. It's more subtle than that. And sometimes the question can't be answered, or can't be answered in a time frame that suits the policy. So I think having Peter on board will, we hope, and I'm sure it will, give us a better chance for the feedback from the departmental end to come to us, but also from the feedback from the research end to go back to the department. What's the most useful way researchers and policy people can interact, or ways, because I don't think there's any one way that fits all purposes. So that's our, if you like, the nub of our knowledge translation and exchange. We do that in relation to the work that we have funded, or the questions that might come. And one of the outcomes I would hope from Centres of Research Excellence would be that the departmental people have access to a body of expertise which they know is built on excellence. It's been formed. It works in this area. They're the sort of the experts in these fields that they can go to from time to time, even just orally on the phone, and say, look, what do you think about this? We've got this problem, blah, blah, blah. And so without there being a whole process of research undertaken to answer that one question, the experts can say, well, look, we think the answer might be here, or we're aware of some work that was done over there, and there's an iterative process between the policy people and the research people. So I think it's all about building relationships, and the evidence of where policy and research can work well shows that a lot of it is around relationships. I think that covers it for now, and we can. Sorry, I think that covers it for now. We can take more questions, but that's what we're on about here. Is really that last statement I made: building relationships and looking for effective tools. And the innovation that Vicky and Dagmar mentioned in research also, I think, extends to the knowledge translation. We are looking for ways that work rather than just a formula that we apply. So I'll leave that for now. Thanks. Will.
Thanks, Bob. And thank you, Dagmar. So Bob's talked a bit about the ethos of our communications and our knowledge exchange activities at the Institute. I form part of the communications and media team, so we kind of look at doing things on the ground. And so Bob's talked about the 1-3-25 reporting system. There's also, from time to time, when travelling fellowships come up, or when research groups have finished their projects, that we look at organising the dissemination of those findings, and we can do that in various ways through the public lectures that we often hold here at the ANU, organising some stakeholder engagement sessions where the lead researchers can talk about their research and how it impacts on the primary healthcare policy landscape. And also Bob has really talked about the ongoing sessions that we hold at the Department of Health and Ageing through the Conversations with APHCRI series, and also other presentations as they arise. The key questions that we look at, and I'm just giving you a very broad overview of it. So the communications and media team work with the different teams, talking about how they might like to get their findings out into the community and also into the policy sphere. So we have a discussion about that, about what you're trying to achieve, who you're trying to communicate your findings to. Often, thinking about your audience, it will change. You'll have policy advisors within the Department of Health and Ageing. It might be at a state level or at a territory level, or you might be looking to influence different policy groups, whether it be the Australian General Practice Network or a nursing group, what have you. So we involved in those discussions with you. Often thinking about a different message for a different audience member, so we can help you tailor that. And thinking about the different models that we've got, whether it's a media release that we might work on together, or it might be a report or what have you. And then there are different ways that we can go about disseminating those different items. So the key message I want you to take away is that we're here to help you. If you're lucky enough to become part of the network, we can help you develop a communications and media strategy for your project, whatever it requires. But we also say that you should think about this ahead of time and involved in discussions in terms of what it's likely to cost, and so you can build that into your project budgets. But I think that's it. Thank you.
So what are the research themes? What we've done is we've aligned the research themes with the national key direction areas of the National Primary Healthcare Strategy. The research outcomes from the Centres of Research Excellence will generate new knowledge to support the implementation of that strategy. APHCRI anticipates that the Centres of Research Excellence will lead the nation with innovative research that will raise the profile of Australian primary health care research as a leader in the international arena. APHCRI Centres of Research Excellence can be at the forefront of international primary healthcare research. Research